afternoon, everyone. I'm really happy that so many of you have registered and sort of joined this course. It now really is very gratifying, and now from the bottom of my heart, I thank you for this response. So, without wasting much time, let us get into the presentation. So, I'm going to talk about how to communicate effectively using SBAR. So, just to familiarize ourselves, it's a communication tool used by nurses and doctors, mostly by nurses. I don't think many doctors are using this. And the components, all of you are familiar. I stands for introduction, S for situation, B for background, A for assessment, and R for recommendations. So why should you use SBAR? So there are many reasons, but I want to focus on two main things. So one is clarity and another is consistency. What do you mean by clarity? So there are two things when you tell the word clarity. This is actually, what the dictionary says, and it's very practical actually. Clarity means coherent. That means you should be able to speak clearly and logically. And you should also be intelligible. That means what you say, the other people should be able to understand. So these two things ISBAR does very well. Now, because of using the tool, you can speak very clearly. Of course, it is up to you. But logically is what ISBAR helps us. And to be able to understand what you're saying uniformly across the organization, it helps. And that is where consistency comes in. So consistency, when you use a particular tool, you should have the same level of success. Okay, so it's like, using any tool. Now, if you use a drill, it should achieve the same depth every time. That only it is consistent. So similarly, if you use the ISBAR tool, it should have the same consistency. So this is where one of the shortcomings is. Now, it all depends upon the user, how we know this, whether the same level of success is going to come or not. And today we'll see how we can actually adopt certain strategies to make this happen. So once you do this, like a magnet, automatically this will lead to increased quality of care, reduction of medical errors, patient safety, and of course, better health outcomes. Now, I want to show you a small video.
Oh, fine. Something to a cardiology registrar. Oh, right. Yeah, great. And then I've got an 82-year-old lady here. She's had palpitations for 12 hours, and she came right in by ambulance about half an hour ago. And I'd like to come and see her. She normally takes amiodarone, ECGs. Oh, hang on, I'm not sure. You were felt. You were told. And maybe on the thing. Hang on a second. Oh, yeah. Yeah, I've got it here. And she's got a rhythm. Yeah, it's a bit fast. I don't know. Hang on a second. Jen, what's the BP? Yeah, 90 or 50. Yeah. Is it a bit full? My dad. Oh, yeah, sorry, it's true. Yeah, okay, bye.
ISBAR is not used well in many hospitals. And why is that happening? So, there are confusion in what we have to say. And also sometimes, like in the example you saw, what you should have at hand before you use ISBAR to somebody else. Now, what should you have in hand? And what is that you have to say? So there is a gap. And that is one of the reasons ISBAR is not used well. So I feel lack of preparation, not just a few moments of preparation before using the ISBAR tool is probably the root cause for lack of adoption. One, and even if it's adopted, it is not used very well. So this is what I'm going to focus in this rest of the presentation. So we are presenting one more addition to ISBAR that is called O. O stands for organize. So I will call this the step 0. Your step 1 starts from identify, I. So, but here I'm telling you that let us start with O, that is organization. So that is, you have to be organized. So it's O-ISBAR is what we have to think about. We've not altered ISBAR, just added one in front of it. So what is that you have to get organized? First, you have to get yourself organized. So be calm and speak clearly. Next is be prepared with the pen and the case sheet. See, most of the time what happens, we write in the back of the hand or in a small a slip of paper, and maybe we can lose it. This is another important cause for communication errors. So you should have the case record with you and write it in where you're supposed to write straight away. So this avoids transcription errors. And be prepared to address any doubts or questions that the doctor may have. So Then you have to organize your thoughts. So to organize your thoughts, this is where the SBAR helps. So what is the current problem? Think about it. Be is prepared what to say, and gather what are all the essential information to give the background, and what is relevant assessment, and formulate any necessary requests. So I will go a little bit dive deeper into each of these components, but this is how you have to organize the thoughts in the beginning itself. That's what I'm trying to say. And organize the patient's information for quick reference. Have all the relevant pages of the patient's record. If you're talking about blood glucose levels, have that page open and ready so that you can talk. The doctor asks, what is the previous one? You can quickly tell that. And you should also have the relevant charts open along with you. So this organization is very, very important before you start the SBAR, and that will greatly facilitate their use of this tool. Now, the first one is introduction. This is pretty straightforward, but I want to stress that you need to do not 3 things or 4 things. You have to first greet the person, this basic etiquette, introduce yourself. Who is that is talking? Where are you calling from? Many doctors are visiting in many hospitals. So you have to have that empathy, and you have to tell that I'm talking from this hospital. It will greatly help the doctor or whoever you're talking to. And then introduce which patient are you talking about. So for example, you say, hello, Dr. Kamala. I'm Nurse Geeta speaking from the surgical ward at so-and-so hospital. I'm calling you regarding Mr. Somo, who is 50 years old and who is in room number 203. So please don't tell just the room number. Now tell the patient name, and then the connect will happen immediately. So this is some important points in introduction. But when you come to S, that is situation, I want you to remember one more S. So when you talk about situation, you be specific. What do you mean by specific? It should be clearly defined or clearly identified. There might be many other problems a patient might have, but what is the reason for which you are calling that particular person or communicating with that particular person? This has to be specific. So state the situation, the specific situation for that particular patient. So let's go through some examples. So the present issue should be stated clearly. Patient is expressing severe shortness of breath. Yes, it is pretty clear. It can be relevant details also, where you include the room number. Patient Somo in room number 203 is experiencing shortness of breath about 15 minutes ago, from 15 minutes or for about 15 minutes. So this gives the urgency, conveys the urgency. So the specific, when I mean, you should not leave other details, but the relevant details also should be added. So remember, S stands for situation. Also add the prefix specific situation. So you just talk about that and don't go, talking about this and that. So the next is background. Again, brevity is very, very important for background. Brevity is an English term which says somebody has the capability of giving a lot of information clearly in a very few words. It is something a skill which you have to develop. Now, especially if you're calling me at 2 a.m. in the morning, I don't want a long discourse about the patient. I want, very brief but very specific background. So this is something which we have to remember. So remember B for brevity for background. So don't tell all information or irrelevant information. Here, we can divide into the information you must share and what information you should have. What do you mean by you should have? You should have either, in your preparation phase, you have it in your memory. So this is the background information I'm going to give for that particular situation. Or you can have the chart ready with you at your fingertips so that you can quickly, turn to that page. And if any questions are asked, you're able to tell that background. So this is, very, very important. So let's see some examples. So what information you must always say is that event which led to the problem. So for example, if I call somebody, another senior doctor and say, this patient has had urinary retention. He's not passed urine for the last 6 hours. So that is the situation. Now, in the background, I'll say this patient had a hernia repair at 9 a.m. in the morning. So that is the information I must always say because that is an event that led to the problem. And always tell about allergies and sensitivities because when the doctor prescribes, you should be aware of that. So this is information you should say. So that is the brief and short and sweet thing you say. But you should always have all the rest of the information with you. So the relevant course, the past medical history, the current medication, recent changes of events, mental status, code status, whether the patient for resuscitation or not. See, one of the reasons when we train ISBAR, teach other people ISBAR is, we put all of this information when we talk about the background. So, it's overwhelmed. Now, there's too much of information. So, when people look at the tool ISBAR, they think, it's so difficult to use. How am I going to remember so many things? So, we are trying to prioritize certain things in each of these steps. So, identification is straightforward. You have to tell who you are, where are you from, which patient you're talking from. And when you talk about situation, you just tell the specific thing for which you're calling the patient. And the background, what led to that particular situation alone, you say. And then the other things, you can, if it's relevant, you mention. Otherwise, if the, other person is asking, you should be ready to answer that. And always tell about allergies and other sensitivities. So, for example, this patient who had shortness of breath, Mr. Somu had shortness of breath. So, this nurse is telling about the relevant background. This patient has chronic kidney disease and has missed the last 2 dialysis. See how important this background information is to the doctor. So, this is the, brevity. That is, they're given all the information in one sentence and the doctor understands. Okay, now he already made the diagnosis, right, for the shortness of breath. So, that's important of background. Now, A, again, is appropriate assessment. So, appropriate is suitable or proper in the circumstances. So, for the situation, and now you have now talking to that other person, what is the assessment you have to tell? So, is it appropriate? Now, just tell the first assessment is appropriate. So, for example, is hypoglycemia, you're going to tell them the glucose level. If you're talking about pain, you're of course going to talk about the pain scale. Now, there are so many assessments. You can tell in ABCDE, you can tell about complaints and symptoms, vital signs, lab results, pain scale, and what is the time scale in any of these, or is it sudden or gradually happen? All these are important. What is that the first year going to say is appropriate? So, many assessments are there, but you choose the appropriate and critical finding and tell that. And be, ready with the other information. So, this will make your conversation short. Finally, the R stands for 2 different aspects. So, this is another thing which when I attend the classes on ISBAR or I see people teaching ISBAR, some of them will say recommendations or will say requests. But actually, I feel these 2 are both important for anybody who's giving the using the ISBAR. So, request is what you request the other person. So, I still remember this, what happened to be when I was joined Railway Hospital Perambur after my house agency. So, this was my first week of on-call and I was totally at sea. I didn't know what was happening. So, in the ICU, there was this senior nurse. I still remember her name, Shanti nurse. So, she called me for a patient and said, I'm worried about this patient. Patient's baby is not holding. Can you come and see? So, I came and saw. And to that extent, I couldn't make out anything. So, I said, just give some IV fluids. And I was about to leave the ward when she said, I think you should call the consultant. Looked at straight in my eye and said, you should call the consultant. And we had a lot of respect for that particular nurse. So, I immediately picked up the phone. And it turned out that the patient was having a postoperative bleeding. We immediately shifted the patient. And because of that empowerment and the confidence that nurse showed that day, that patient's life was. So the requests are very, very important. Now be, confident and tell, I want you to know if any order is being given over the phone, you can tell, no, sorry, doctor, I want you to come and see the patient. I'm concerned. And 99 out of 100 doctors will come and see the patient. They won't shout at you. Okay. So recommendations are sometimes, you might say, can I start this? Can I do this? Yes, they are recommendations, but also recommendations given by the doctor. You should be ready to listen properly. Listening skill is very important and note it down in the correct place. So the two different things, requests and recommendations. Please remember that. So decide which aspect do I want to communicate. Is it request or am I asking for a recommendation or is it both? So that you have to remember. So now I'm going to show the video of the same doctor, but he has attended my talk and we'll see how he's faring at this moment.
Oh, hi, is that Dr. Harrison, the cardiology reg? Oh, yes, I'm sure I'm the weekend peering into it. Yeah, I'm phoning about Nora Blind. She's an 82-year-old lady in bed 6 here on Ward 4 of Moraman Hospital. Yeah, I think she's got VT. and I'm just phoning to ask your advice about her management. Yeah, well, she's stable at the moment. I'll just tell you a story. She's a well-looking 82-year-old lady with a history of an AMI 5 years ago. She's normally on warfarin and social offer AS and Flocaid Frusemide for mild heart failure. And after mild shortness of breath, she looks okay. She's fully conscious and orientated. Her heart rate's now 150 a minute and blood pressure of 90 on 50. And her ECG shows a forward complex tachycardia. I've given her some oxygen and put an IV in, and I think it might be VT. You think you could come and have a look at her as soon as you can? Great, thanks.
Okay. So you see how this man is transformed, once he knows how to use the ISBAR tool. So in summary, you have to organize yourself, your thoughts and chat, and then go through the ISBAR. So first is greeting and introduction. S, remember the word specific for S and relevant. B is brevity. Keep the background short and for the situation you're talking about. And just tell the appropriate assessment. You saw in the video how he was just talking about whatever the background information and the assessment which is required that for that particular problem he was discussing with that registrar. Then finally, he didn't tell about what he has done, his recommendation. He already started an IV and all that. And then he requested the doctor to come and see the patient as soon as they can. So this is, I think my deep dive on ISBAR, where I've added the word O before ISBAR, where I think this is the reason why, even when you teach or when you practice, sometimes you find variability in people using ISBAR, and sometimes it's not, people don't understand what this is all about. Mainly because I think we cram so many things in each of these components, as all this list, be all this list. Now, if you tell them that this is what you need to say, but these are the things we need to keep ready, then that is very, very helpful for people who practice it.